Okay, this is Teamwork and Collaboration by Kevin Musicka. Quality and safety education for nurses equips nurses with the appropriate knowledge, skills, and attitudes in enhancing patient care and healthcare delivery, according to Stoller ETAL 2017. Robert Wood Johnson Foundation finances the program in equipping the future nurses with the appropriate skills, knowledge, and attitudes in promoting patient-centered care while fostering safe and conducive environments. One of the vital QSEN competencies in teamwork and collaboration, according to Gruber and Flynn, 2018. This competency requires the nurses' acknowledgement of their strengths and limitation that impact their contribution in the team. Ideally, nurses should capitalize on their strengths in enhancing their effectiveness in the teams while addressing their weaknesses. Importantly, practitioners should recognize the value of teamwork and collaboration and embracing teamwork in their operations. Practitioners should be knowledgeable in their strengths, values, and limitations in functioning as members of the team. This knowledge is vital in determining how best to contribute to teams and enhancing their input. According to Rosen ETAL, the nurses should be knowledgeable in their scope and nursing practice and comprehend their role in the healthcare team. The nursing practitioner should be knowledgeable of the strategies of the identification and management of overlaps and responsibilities and accountabilities. Importantly, nurses should be aware of the contribution of the individual groups that help families and patients attain their health goals, for instance, nutritionists and therapists, according to Senzel and Yoder, 2020. The nurses should be aware of different communication styles used in the team, which stems from variations in culture and professionalism. For this reason, nurses need to identify effective communication tactics which they should use in promoting team cohesion. According to Altmiller and Hopkins, P. 2019. Nurses should be knowledgeable of barriers that hinder collaboration in the healthcare sector and promoting the innovation of strategies to effectively overcome these impediments. Importantly, nurses should analyze strategies for promoting systems and enhancing the effectiveness of healthcare teams in the organization. Skills. Effective team playing requires the members to be aware of their strengths and weaknesses to effectively contribute to the team. Ideally, members should capitalize on their strengths when serving in the teams while addressing their weakness, according to Hopkins and Peet, 2019. For this reason, the nurse should design and roll out their self-development plan, enhancing their effectiveness and accomplishing their assigned roles, according to Senges and Yoder, 2020. Importantly, the team members should act with integrity while ensuring they respect different cultures and opinions in the team and promoting team cohesion. The team members should ensure they competently function within their scope of practice for effective service delivery. According to Gruber and Flynn, 2018, the team members should be ready to switch up roles in the team if the situation arises and requires them to take different responsibilities from those assigned. Importantly, the nurses should ask for assistance if they encounter challenges in accomplishing their assignment. The nurse leaders should clarify accountabilities and roles in cases of overlap of duties and mitigating conflicts. Nurses should ensure they integrate the contribution of team members and families in ensuring the attachment of goals. Also, they should adopt communication that fulfills the need of members in the team. Practitioners should illustrate their dedication in fulfilling the team's long-term and short-term objectives. Nurses should solicit input from team members, which is vital in enhancing performance. Importantly, nurses should actively participate in conflict resolution and fostering team cohesion. leading to improved productivity, according to Senges and Yoder 2020. Although nurses are expected to display team playing skills, they are required to assert the position in healthcare. The nurses should declare their stance on healthcare issues, according to Grupo Flynn 2018. On the same note, they are required to be respectful of divergent ideas and opinions. Importantly, nurses are encouraged to select communication style that minimizes risk stemming from authoritative gradient in the team. They are also required to participate in developments that promote effective teamwork. Nurses are also required to execute communication practices that reduce risk arising from handoffs to healthcare providers, which would lead to violation of healthcare legislation. Attitudes. Nurses should acknowledge their capacity in contributing to the effective function of the team. Also, nurses should appreciate the value of intra and interpersonal collaboration. They should appreciate the contribution of members from healthcare industry and that from members operating in our industry, such as social workers. Spencer 2021. For this reason, the nurses should respect the different perspectives of the team members. Also, nurses are expected to respect the families of the team members, e.g. patients next of kin, since they make a vital contribution to the teams despite their limited professional capacities. The nurses are also expected to respect the differences in professional orientations. For instance, a physician should respect a social worker's opinion despite the broad professional differences. Also, the team leaders and members assigned with more responsibilities should respect members assigned with minimal responsibilities. Nurses are expected to uphold teamwork and recognize its value in promoting the accomplishment of goals of the healthcare organization. Senges and Yoder 2020. Nurses are expected to embrace different communication styles used by different members of the team. For instance, nurses should minimize jargon when addressing family members with limited healthcare knowledge. The nurses should value the influence of system solution in promoting effective team functioning. Importance of teamwork and collaboration. Teamwork and collaboration promotes the implementation of patient-centered care through facilitating the sharing of information between the physician and patient alongside their families. Teamwork and collaboration facilitates the integration of medical records and facilitating sharing of patients' information, for example, medical history. Rosen et al. 2018. Teamwork ensures the delivery of informed consent in a timely way and allowing the patient to make vital decisions on their health. Also, collaboration promotes the collaboration of healthcare practitioners with members such as family members and patients. Grupo and Flynn 2018. Teamwork and collaboration is beneficial since it promotes their safety through minimizing medical errors that they may lead to complications. It also enhances medical performances through promoting efficiency while reducing healthcare costs. Also, teamwork reduces the patient's concerns on treatment and process through explaining to the details on effective administration of the treatment. Barriers to teamwork and collaboration. The effective implementation of teamwork and collaboration is hindered by organization barriers and impediments at the team level. Organizational barriers include insufficient knowledge on teamwork by a leader and subjects that hinder them from adopting this approach and enhancing the quality of patient care. Spencer 2021. Also, lack of support by senior leaders in the organization may sabotage teamwork and collaboration, which that can be very true. Some leaders fail to recognize the value of this approach in enhancing service delivery. Cronwhite and Barnsteiner 2021. Also, teamwork is hindered by financial constraints due to insufficient resources in a company. The regulatory constraints also limit the execution of teamwork on a company Companies may fail to execute teamwork due to legal issues. For example, the sharing of patients' information across a team predisposes the organization to a violation of HIPAA, which may lead to lawsuits. At the team level, teamwork and collaboration is hindered by ambiguity in roles played by members, leading to conflict. Also, ineffective teamwork arises from leaders' lack of understanding on their responsibilities in the organization, according to Rosen et al. 2018. Teamwork is also hindered by incompetency and interprofessional collaboration, which is vital for successful team playing. The lack of a clearly stated measurable purpose impedes effective teamwork in the organization. Also, the absence of effective information sharing mechanisms hinder teamwork. The barriers faced by team members include gender, racial, class-based prejudices, which lead to poor relations among the team members, which sabotages team cohesion and hinders delivery. Stereotypes hinder members from recognizing value delivered by members. Team members may also be reluctant to accept and incorporate suggestions from team members, which sabotage team playing. So in summary, teamwork and collaboration constitutes a vital component of QSEN Competency. Teamwork and collaboration is vital in my Bachelor's of Science in Nursing profession. Effective team playing would enable me to effectively identify and communicate a patient's preferences, needs, and values to a member of a healthcare team. It would also enable make delivery patient-centered care through delivering treatment while respecting the patient's diversity. Teamwork and collaboration would enable me to execute treatments that relieve patients of their suffering. Also, I would effectively assess a patient's decision conflict and facilitate access to the required resources. This competency would also enable me to identify and eliminate barriers to teamwork and collaboration. That is the end of this PowerPoint. Thank you.